guys, welcome back to Transition Dietitian. Sorry it has been so long since my last video, but I have recently finished my internship, took my exam, and have been job hunting. So I've been kind of busy lately, but today we're going to be going over my clinical rotation, what kinds of assignments I did, and what other kinds of things I needed to do in order to get my evaluation for my clinical stuff all checked off. So forgive me for this, but I'm just going to read right off of my evaluation just to make sure I don't miss anything, because in the clinical evaluations there is a lot of stuff that you need to do. So we'll just go ahead and we'll jump in and do this. So one of the first things that you're going to do is you're going to do a quality management project. So that's going to be the same that you did in food service, where you identify something that isn't quite going right and you try and improve it. Mine was the nurses weren't putting in the diets immediately when the doctors had prescribed them. So I worked with the nurses to try and get them to do that a lot faster so that we were following all the HIPAA and the hospital guidelines. Your preceptors are going to evaluate on your knowledge of ADIME or SOAP notes, whatever the hospital uses, so make sure that you know the nutrition care process very well. Let's see, you're also going to be evaluated on knowing the code of ethics, and the HIPAA and the Joint Commission standards, and they're just going to mark off on that. You're not going to get a test or anything, or at least I didn't, but they just want to make sure that you do know that. You're going to be participating in counseling for acute and also non-acute counseling sessions based on diagnoses. So you'll probably be doing a lot of diabetes counseling, some hypertension counseling, eating disorder counseling, stuff like that. It's really great. You might start off working with your preceptor, just kind of watching her, but then as you progress through your internship and your preceptor starts to trust you more and understand your skill, she'll let you go off on your own, which is one of the best parts of the internship, is getting to do stuff on your own. You really start to feel like a dietitian. So that's really fun. Let's see, you're going to do 40 hours of staff relief, so that's going to be pretty exciting for you. What my preceptor had done was she just gave me, the admittance list of everyone from that day, and just kind of said, well, go off on your own, see people in the order that you think they need to be seen, do the reassessments, make sure everything is done right, charted before you go home. So you'll do that for 40 hours. Let's see. While you do your 40 hours of staff relief, you're also going to make a supervisory decision. From ACEND, they want you to do that. What mine was while my preceptor was doing the staff relief, she actually had gone on to the Caribbean, so I was literally by myself at the hospital. A patient came in that needed a tube feeding, and the doctor had run out of an elemental formula, so I kind of had to track down the purchasing agent for the hospital and get them to order that. And then while we were waiting for that to go on order, my supervisory decision was to put him on a different kind of formula until we got the elemental one in. So it's going to be something like that, but not too bad for the most part. You're just going to be interviewing patients a lot, doing the full assessment, the reassessment, doing a lot of charting is what you're going to be doing. But in school you learned how to do that during your case studies, so you will be fine. Trust me, and a lot of them are just like fill in the blank or click this bubble or that bubble based on the patient's diagnoses. So you guys will do great on that. A big one that you're going to do is to learn how to interpret different labs and kind of figure out how they relate to each other for different diagnoses, which one is the most important one you should be looking at now, which one can you have the best effect on. So going off that, there is a giant list that ACEND prints off that you need to know the lab numbers for. So just to go off some of the most common ones that you'll need to know is like albumin, transferrin, glucose, sodium, potassium, like all the electrolytes, cholesterol, triglycerides, prealbumin, stuff like that. But some of the ones that I would advise you guys to look up before you start your internship, which I had never really used before, was LPA. Still don't really know what that is. Let's see. 3-methylhistidine. That's pretty cool. Prothrombin time, I kind of knew what that was, but I didn't exactly know what it meant in the nutrition world. Osmolality in urine, specific gravity, immune reactivity studies, creatinine height index. So there's just kind of ones like that you're going to want to know based on that. And then you do have to know certain diagnoses pretty in depth. So that includes type 1 and 2 diabetes, GI cancer, just regular cancer, renal disease, cardiovascular disease, liver and pancreatic dysfunction, enteral and parenteral nutrition. So those are the main ones that they want you to know. But going back to what we were talking about before on the list of assignments, the lab values and knowing all that is going to be really important for your case studies. I'm not sure how many case studies you'll have to do. My friends at a different internship had to do like 12 case studies, but I only had to do 5. You have to do a minimum of 2 acute diagnoses and then 2 complex diagnoses. So a couple ones that I had, there was one that had like an ileostomy. There was one with just diabetes. My complex one, I had an anorexia nervosa patient that had come in. I also had a refeeding syndrome girl. Those were 2 different cases. And then another one was a patient that was admitted into a hospital in Colorado that, specializes in the spinal cord and the brain injuries. So that one was kind of complex there too. So you're going to be doing 2 of those. It's just going to follow the basic format that you followed in school with the ADIME is really what most internship directors are going to be looking for in your case studies. You're going to develop some nutrition intervention plans for both patients and communities around the hospital. You're probably going to be giving an in-service presentation either to the kitchen staff or like the nurses or the CNAs or something like that. Mine was to the kitchen staff and talking to them about the dysphagia diets and why it's important to get the food to the correct consistency. So it's just going to be something like that. It'll be pretty simple for the most part. Let's see. You have to know all the different diets, dysphagia 1, mechanical advanced, mechanical pureed, etc. You probably learned that in school, but good to know, to check up on. Let's see, you're going to write an employee schedule, participate in a community-based health promotion or a disease prevention program. Some hospitals will do that. Review the organizational chart of a hospital and see how clinical nutrition services relates to other departments. Let's see, you're just going to go over the hospital's policies and procedures, HR. You're going to go over some journal articles with your preceptor, and then also participate in the billing functions. Now, I didn't really get a great exposure to that. My senior year, our program director was on sabbatical, and so we didn't really get to go over the in-depth billing functions, and then during my internship I just never really was exposed to it. So I think this would be something really great to ask your professors about if you're going to learn this in your program, and how important it is to learn, because you never know what your internships are going to be like and how much your internship directors are going to expect you to know coming out of your program. So that's really all the stuff that's on the checkoff list from ASEND to do during your clinical rotations. It's going to be super awesome. You're going to be in a bunch of different places, like hospitals. I was in a dialysis clinic, a specialty hospital, which was the spinal cord and brain injury one. You're going to do long-term care. You're going to get some outpatient. Those are all the different fields that you are required to work in. So it's just going to be super fun. You're going to do a lot of charting. You're going to work with the doctors and the nurses and the kitchen staff. So it's going to be a really good time, and you are going to enjoy yourself totally. I already know it. Although clinical was kind of my favorite, so I'm a little bit biased. But the next 2 videos that I'm going to be uploading are going to be on how I studied for the RD exam, what kind of stuff was on there, what resources I utilized, and then we also had someone request that I do a video on what internship directors might be interviewing you about during the applications. So I will also do that, and then for those of you doing distance programs and you're trying to get a list of different preceptors, I'll also give some questions that preceptors will ask you in interviews when you're trying to get them on your list of people. But other than that, let me know in the comments below if you have any questions regarding the clinical rotation, and I will answer those as soon as I can.